Just to introduce myself to, if we have anybody in the live audience, I'm David Wortley. I'm a Vice President of the International Society for Digital Medicine, which was set up in China in 2016. And it's my great honour and pleasure to speak to you today at the ICSAD conference, which is a multidisciplinary conference. And today we're going to be talking about digital health and digital medicine. So I have a presentation loaded, which I will now share. And so I'm sharing it with you, and I'm sharing it with what audience we have. So, okay, so far so good. Thank you again for the opportunity to talk to you. The primary aim of my presentation is to show you how virtual reality and digital therapeutics can be an important part of the future of medicine and healthcare. Before that, I just want to go through a few slides very quickly that sets this into context. When we're talking about digital therapeutics, the examples that I'm going to be showing you involve the use of a virtual reality headset. You can see me with the Oculus Quest headset there. But there are other ways of using digital therapeutics for physical health and well-being. And the other picture shows an application from a partner of mine, which is based in they're based in Italy. They're called Imaginary. They're based in Milan, and what you're seeing on the screen there is a game which is designed for rehabilitation. So this is for people who've had strokes or Parkinson's disease, and they're using a device called the Microsoft Kinect or a similar device on top of the computer, and by playing the game, it encourages them to comply with their rehabilitation routine. So the background to my presentation is that we really face a challenge. Everybody's heard, I think, of the aging society. And the problem is that we are living a lot longer. And as we go into old age, to get to my sort of age, we tend to need more medical care. And so what we're finishing up with is a lot of older people who are needing medical care, and less working people able to support them, and less clinicians able to support them. My father died when he was 69. I'm 72 now, so I managed to stay alive a little bit longer than him. But when he was 69, before he died, he'd had a good number of years of ill health. So my generation is extremely lucky that we are blessed with the opportunity to live longer. But the downside of all of this is that there are fewer and fewer people supporting the retired population. In 1945, you can see that there were 42 workers supporting one retired person, 1945. Today, 2010, that's gone down to 3 people supporting each retired person. So it's a massive change in society, and this is why in the UK and other countries they are changing the retirement age and putting it further and further, because people are living longer and there isn't the money in society to be able to support them. So one of the other challenges with living longer, this is a picture of my mother. My mother suffered from dementia, and this is a picture of her in a hospital in critical care. And so she is a good example of an individual who, as they got past my sort of age, needed an increasing amount of care. So we need more medical care, fewer people to cover the costs. We are also changing exponentially as a society. We are able to move about, not just to travel, like I travelled yesterday here from the UK, but also younger people are not staying with their parents, so you don't have family groups. The children are moving away to make their own lives. The other thing is that, certainly in the UK, social care looks after old people is very much a poor relation of public health services. So I know that if I get to need care, it's likely that I won't get the level of care that my mother had when she was very ill. And finally, coronavirus really has exposed our vulnerability to the unsustainability of public health services. So if we're going to do something about it, we really, I see it, only have three choices. We can develop clinical cures, vaccines and drugs, which we have been doing very successfully to combat coronavirus. We do need to do that. We can also employ legislation. We can make rules like social distancing in order to prevent the spread of diseases. And a lot of governments, certainly in the UK, have used legislation to affect healthcare. And finally, and I think most importantly, we can look after ourselves better. We can accept more responsibility for our own personal health. So technology is a fantastic tool to help us to do that, but it's kind of paradoxical. It's like a devil and an angel sitting on our shoulders. On one side, we can say, as it's very tempting to do, that we needn't worry. Technology is going to solve all of our problems. There'll be a cure for everything one day, so we can carry on enjoying our life. We don't have to worry about it. But on the other hand, we could say, well, it's a great opportunity to look after ourselves better and give ourselves a chance to live a longer and healthier life. So my point is that we very much need to make the transition when we think about medicine and health from cure to prevention. So the best chance that we have of having a healthy, active lifestyle is to do something about our personal behaviour as early as possible. But this is not easy. We get used to a comfortable lifestyle. I get used to go down to have breakfast. I can eat what I want. I have a lot of freedom, and it's not easy to change our lifestyle behaviours. I did this, and this is a reason why I'm involved in personal health management. 8 years ago, I started using wearables. So I have two at the moment. One is a Fitbit, another one is a device from China. And I started doing this, first of all, by using the devices to measure how many steps I did every day. And then I realized that I could also monitor my diet. And so when I started back in 2013, within 3 months, I'd lost 21 kilos in weight, simply by using these devices, making sure that I got my 10,000 steps and exercised, and importantly, ate the right kind of food. So these are the things that we can look after ourselves to influence our health and well-being. I think one of the most important things, which is not addressed enough, is in diet. Recently I did a presentation on diet and nutrition and the technologies that are being developed to help with that. Exercise, of course, hydration. I learned myself is very important to have enough water every day. Sleep, mindfulness and stress management, where I'm going to be talking about some of the solutions there, but also support, social support, people around you to encourage you and motivate you. So to do this, there are a series of key steps you need to be able to do, and this is where technology comes in. The first thing is, we can't change things if we can't measure them. So we need to measure the key influencers, like our physical activity, our diet, etc. We need to create benchmarks for ourselves, and these benchmarks need to be achievable. It's no good saying to somebody who's 90, well, you walk 10,000 steps a day if they're in a wheelchair. So you have to set goals which are achievable for the individual, otherwise they won't be motivated. You need to build a supporting environment, provide the kinds of tools that I'm going to be talking about, and they're not necessarily expensive, and finally, encourage people to be responsible for their own health. So this is what it looks like in schematic terms, how technology is being used in different areas. So I'm going to go straight now into digital therapeutics. and life after COVID-19. I want to introduce it by showing just an example. This is my partner's father, Eric Jepson. He died last October, and he was 96 years old when he died. He didn't have dementia, so his mind was very active and sharp, but in the last year of his life, you see on this side of the screen, this was his drugs regime. That was the amount of drugs he took every day. Not the quantity, but he had that set of drugs. And so his life depended upon this cocktail of drugs. And this is one of the challenges of today, is this comorbidity challenge. When it was becoming clear that he wasn't going to recover, they changed his drug regime, and on his end-of-life care package, he finished up with just a smaller number of drugs. So as a society, we've become increasingly dependent on drugs, and drugs don't always work well together. So very often they can cause as many problems as they solve. So how do digital medicine, digital therapeutics come into it? Well, on the right-hand side of the screen, there are technologies which influence our behaviours and help us to make informed health decisions. This is a kind of embedded wearable next-generation device that will replace things like Fitbit. It's something that can lay on your arm instead of wearing it as a watch, and it will increasingly measure a wider range of things. And then on the right-hand side, we have virtual reality. I've shown you this picture already, a company called Imaginary. They've had some really successful results using games and these kinds of technologies to help people comply with exercise regimes, and they don't have to be in a clinic. They can do all of this at home with their family. So, looking at digital therapeutics for active aging, this is me with my virtual reality headset, and you can see that I have in front of me a little bike, and this is something you can put on the floor and pedal, or it's something that you can use with your hands. And what I'm showing there, and there should be a video to follow this, is the exercise. So this is me starting the gamified exercise, and this is a program called VZ Fit that runs on a virtual reality headset, and what it allows me to do is to exercise in virtual reality. So when I'm pedaling, what I can see on the screen is this track. This happens to be in America. But if I wanted to, with this program, because it's based on Google Street View, I could have an exercise path that started from this hotel and went along the beachfront. So I can make my own exercise routines with this program. So another example, and this is, I think, is something which I think you'll be interested in trying, is something called TRIP. TRIP is an example of the use of metaverse for digital therapeutics. And basically, it's an environment, a beautiful environment that allows you to, or helps you to meditate and look after your breathing. This is something that I developed for myself. I call it 360 and 360 Living Memorials, because one of the things I think that digital technology does for us is to capture our memories in 360 degrees, like I'm doing here. So you can relive something. So in this case, what you see on the screen here is, this is my living room, this is where I live. And we have Eric, who's no longer with us, and his girlfriend, and they're talking about how they met and their life. And I recorded this in virtual reality. And I made a website which has other examples. And this website has on the wall, it has, like Harry Potter, moving videos of my partner and her sisters. I'll just show you what the video... This is something available on the internet if you want to look at it yourself. So I just recorded this, and part of it involves setting up a family tree. So if you click on a person, it will play a virtual reality recording of that person's memories. And you can see the pictures are not static, they move. And on the television set in our living room, if I click on the television set, it goes into a virtual reality experience of Eric and his girlfriend talking about how they met. So this is another example which can have very therapeutic values for the whole family. This is one of my favourite metaverse applications. It's called AlcoVR, and it's free. So I do recommend, if you get a virtual reality headset, get AlcoVR, because it allows you to do some incredible things. Apart from a number of health-related exercise, it allows you to personalise your own apartment. And again, I can show you that if you would like to see that on the virtual reality headset. So when we're looking at older citizens, and I include myself in this, there are solutions today for both physical and mental health. But for older people, they have to be plug and play. They can't be complex. They need to combine some realistic challenges with an element of fun, and they need also to engage with the family and the community. And there's lots of technologies available today to do that. They also need to be able to provide feedback and diagnostics to motivate you and help track your health. And this is where wearable devices come in. So what the end result of this is, they give users control over their own health. So this is my last but one slide, and it's really a cry from the heart, really. If there's one thing that I would like you to take away today, is to start thinking of older people not as a liability or a cost, but think of them as an asset. They have a big contribution to make to society. And if we are able to use technology to help us to do that, I think will result in a better world for all of us. So that ends my presentation. If you have any questions, I'll be pleased to answer them. I'm just going to stop sharing now. So for those people who are watching live, then I will just... For those people who are watching live, if they have any questions, they can type those questions in. If you have any questions, please let me know now. Anyone have any questions? Yes?
Thank you for your interesting subject. But what's the disadvantage of this therapeutics?
The disadvantage? Well, the disadvantage at the moment is the fact that you have a virtual reality headset. The disadvantage is that when you put that on, it gives you an immersive experience, but it shuts you off from the rest of the world. So this is where I think technology is going to evolve, so that you will have better devices that are not so heavy, and allow you to also be in contact with the world around you. The Oculus Quest is able to do that to a certain extent at the moment, but that's the main disadvantage, I think, is to do with the virtual reality headset and what I call the form factor of the virtual reality headset. But having said that, and this is something that may be of interest as a collaboration, is that there are devices which allow you to have immersive experiences in virtual reality without the headset. And they work like a projector, like that projector. You have a projector that can be from the ceiling or on the floor, and it projects in 180 degrees around the room. And so if you sit in this environment, you see exactly what I would see on a virtual reality headset. And so some research has already been done in Canada to examine the therapeutic effect of that technology on, and in particular, it's very useful for stress management. So you can sit down on a chair, you can have several people, and they can all share that immersive experience. So that is one way of overcoming the limitations of a virtual reality headset. Any other questions? Yeah.
Thank you for nice presentation first. This digital therapeutics is very promising, but you know that because you have a technology background, you are very familiar to use this technology, but it could be very hard for the older people. And how to solve this problem? How to educate them to use these technologies?
How do you give feedback for older people? Is that your question?
Yeah, just I'm asking the question for the older people to use these technologies. It could be hard for them.
Yes, it's for older people. This is one of the points that I made, was that you need to have plug and play, and it needs to be very simple. I'll give you an example of something that works very well, of how technology has evolved to make it usable by older people. Has anybody used Facebook Portal? Do you use Facebook Portal? Yeah. So for our family, it was a wonderful thing, because it just sits on the television set. You can speak to it to get it to do things, and it's usable by the whole family. It's not complex. You don't have so many buttons to press. And this was the example I showed you of the rehabilitation. This was one of the primary requirements. And so to use the product Rehability for stroke rehabilitation, Parkinson's, etc., you don't need a controller. You just have a box on the television set, and when you switch the box on with just a normal TV remote control, it automatically goes into take you through your exercise routine. And so you see on the screen, you're just using your arms, and it might be that you are, for example, one exercise is to do with both physical and cognitive rehabilitation. There is a game where what you see on the television set is a kitchen with some coloured cans on the shelves. And what you have to do in this game is to reach up with your hand, and when you see your hand touch the can, you move the hand down, and it puts the can on the shelf. And there are different coloured cans. So the game says, pick up a green can. So you have to reach a green can and put it down there. And that's another example. I call it ambient technology. It doesn't require a lot of complication for people. And it's not just older people, it's people maybe recovering from a stroke. You have to give people challenges that they can achieve. Any other questions?